Hi, my name's Kennedy Kirsch, and I'm 17 years old. And in the past year, I found out that I had a brain aneurysm, and I had clipping surgery to repair it. A brain aneurysm is a weakness in a blood vessel or an artery where it balloons up and fills with blood. It's estimated that 1 in 50 people have aneurysms. Most of them don't know it if they're unruptured because usually they don't have symptoms. 30,000 people in the United States have a brain aneurysm rupture every year. If it ruptures, you have a 40% chance of dying, and of the remaining people, 66% of them have brain defects or issues. The main question I get is how I found mine in the first place, and it all started last October. I started getting a funny taste in my mouth. It was almost almondy odor, just terrible, and it started getting worse, and I figured out it occurred every time I turned my head to the left. So it was just kind of weird and random, and it got so bad that I told my parents, like, I can't handle this taste, and so they took me to the doctor. One of the doctors said, well, it's probably stomach acid reflux, so I took a medicine for that, and it didn't help, and it was getting worse. So then I went to another doctor, and he's like, well, I'm not sure what it is, but we'll just do a brain scan. And they were going to look at, like, my neck to see if I pinched a nerve, and so nothing came up on that. And then that same doctor called me back, and he said, I ran into a neurosurgeon in the hallway, and I just said, hey, I have a mystery case, and the surgeon told him, well, this might be overkill, but what if you did an MRA? An MRA is the same as an MRI, but it scans the blood vessels, so you get a good picture of the blood flow in my brain. So I got the MRA on Tuesday, and usually the results come back in a day or two, and they ended up calling back that Monday, almost a week later. They told us that they couldn't figure out what was putting the taste in my mouth, but they said, by the way, you have a brain aneurysm. And they were pretty nonchalant about it. The aneurysm is 3 millimeters, and it's behind my left eye, right beside the optical nerve and internal carotid artery. And they said, well, it's small, and we don't have to worry about it. So they put me with a neurosurgeon in town, and he said, no restrictions. Well, I'll see you in 3 months to check if it's grown. And my parents were the ones who did a bunch of research, and they said, you know what, this is kind of scary. They put some restrictions on me, and they said that I should stop weightlifting because that brings up your blood pressure and it could be risky with a brain aneurysm. So I went back in 3 months, and pretty much what we had expected is if it hasn't grown, I'll see you in a year and we'll check up on it later. If it has grown, we might look at options for surgery. And so I got the MRA, and that was one of the scariest days waiting for the results, but it hadn't grown. So I was really relieved, and I had an appointment to meet with a neurosurgeon. We kind of expected, he can't have much to say because we're just going to get another scan in a year. But when we went in to talk to him, he explained about aneurysms, and he said, well, I want you to actually go to Sioux Falls, which is about a 5-hour drive away, to go get an arteriogram, which is they go through the femoral artery in your leg, and they could go up to my brain to scan it. And he said just to see the size of it and to make sure it's even an aneurysm. So we're like, okay, I guess. We're waiting for him to get back to us on that, and it wasn't before 24 hours that the same doctor called back, and he said, you know what, I've been talking to other doctors and doing research, and I think this is more serious than we thought. I actually want you to go to Barrows Neurological Institute in Phoenix, Arizona, to go get the arteriogram there and maybe talk to them about surgery options. And so we're kind of saying, this is the same doctor who told me to wait 3 months, no restrictions, and now he calls and says, you know, also you shouldn't be lifting more than 20 pounds and you might be getting brain surgery. And so that was kind of a shock, but at that point we're kind of ready to take care of the issues. As he mentioned surgery, we did a lot of research on brain aneurysm surgery, and we found the main 2 types of surgery are clipping and coiling. Coiling is similar to an arteriogram. They go through the artery in your leg, and they go up to your brain and put a metal coil in the aneurysm so that blood doesn't run through it anymore. And with that option, the recovery is pretty simple, but you also have to go get checkups on it a lot more often to make sure that it's actually working. The second option is clipping, which is open brain surgery, which the sound of that really scared me. They just cut your head open, take out a piece of your skull, go in and put a small metal clip over the aneurysm so the blood doesn't run through it. The recovery for clipping is a little bit simpler. Even though it's open brain surgery, you just have to get a scan in a year because it has such a high success rate and they've been doing the surgery for years. So in Arizona, we sent down our paperwork and I was assigned Dr. Robert Spetzler. Doing some research, I found out that he's one of the best doctors for brain aneurysms and he's world-renowned. So that gave me some confidence. When he called, he said, "We're not gonna do an arteriogram. I looked at your scans and we're just gonna come down and do surgery to take care of it. You're young, let's get rid of this. You have the rest of your life ahead of you." Wednesday, May 20th, we flew down to Arizona, and Thursday the 21st, we had appointments all day between registration to Dr. Spetzler's office, and we met him for about 2 minutes, gotta ask our questions fast, and they checked my blood to make sure I was healthy for surgery. Friday, May 22nd at 6 a.m., we went back into the hospital to check in. I had to give them a pee sample, put on my scrubs, and then we waited a long time, and the anesthesiologist came back and she took me back. My surgery was about 3.5 hours long. When my parents talked to my surgeon right after my surgery, the surgeon actually told them that he was very glad we clipped the aneurysm when we did, because when he went in, it was actually very dangerous and fragile, and it probably would have ruptured sooner rather than later in my life. So when I woke up in the ICU, it's a bit cloudy, but my incision was a bit larger than my family had expected, so they were kind of scared, but they did not barely shave any hair, just the necessary pieces, and they left this piece in front. The worst part of my whole hospital experience was definitely the night after my surgery. A nurse came in and he was just like, "Hey, we're gonna take you into MRI right now." And I'm like, nobody had told me that before my surgery. So MRIs, if you've ever had one, they're not fun when you're feeling good because they're so loud. It sounds like construction right by your head. So in the middle of the night, they rolled me into the MRI room and they were talking so loud and the lights were so bright and I felt like a dead body, and they just were like picking me up and rolling me onto the bed, put me in an MRI, and it was absolutely miserable. But luckily everything looked good. The blood in my brain was flowing as it should be. So Friday, Saturday, and Sunday I spent in the ICU, and most of that was because I had so many issues with nausea. I woke up probably every 2 or 3 hours, it felt like. I puked every time I woke up for the first day or two at least. And then the nurses come in and they wake you up, ask you the same few questions, you do the same few exercises, push, pull, where are you, how old are you? I had absolutely no appetite and I didn't eat Friday, Saturday, or Sunday. On Sunday, they moved me from the ICU to a regular hospital room. On Monday, I was actually discharged from the hospital and able to spend the rest of the week in a hotel room. Before I left, I had a nurse shower me down, and it was pretty painful and exhausting and really bloody just as she kind of scrubbed to clean up around the incision, but it made me feel a lot better. And then I was in a hotel from Monday to the next Friday. So the rest of Monday I pretty much slept, and waking up Tuesday, I really hadn't eaten since my surgery and I did not have appetite and I didn't want to eat, but I remember waking up and saying to myself, if I want to feel normal, I need some food in my body. So my dad brought me some oatmeal and yogurt from the breakfast. About an hour after that, I was able to get up with some help and eat breakfast on my own. And we weighed me and I had lost 10 pounds in just those few days. And my eyesight was still really sensitive. I couldn't walk on my own. I had to have somebody on each side of me. Getting food in my body made a world of difference. Tuesday night, my family was going out to eat and I was already sick of laying in bed for so long, so I forced myself to get up and go out to eat with them. But my eyes were still really sensitive, so I was wearing sunglasses. I wasn't able to walk on my own. Wednesday morning, I got out of bed on my own, and I was able to walk on my own with some supervision. Thursday and Friday, I felt so much better. And Friday, we flew home, and I was looking and feeling a lot more like myself. Monday, I got my staples out, and that didn't hurt too bad. It just stung a little from the disinfectant. Weeks after that, I'd just been doing physical therapy to strengthen my muscles. Okay, so I came up with a list of things that the doctors don't tell you that you probably should know and expect if you're having the clipping surgery done, and hopefully they'll help you with your recovery. First is to ice constantly from right when you're in the ICU through the next weeks. I had an ice pack on top of my head and then on the side that my incision was. It kept the swelling down because the side of my face got pretty swollen, and it also helped the pain stay at a low level. Every time you move, your head will pound and it'll feel like your brain is too big for your skull, especially once you try to sit up and stand up. Your senses will probably be in overdrive, and I had vision sensitivity that lasted for weeks, and I wasn't able to wear my contacts for a couple weeks because my eyes were so sensitive to light, and it was hard to see. If your aneurysm's in a similar place to mine, they had to cut through the top here. So they actually cut through my jaw muscle. So I had jaw restrictions when I got out of surgery, and I wasn't able to open my jaw for a while as wide as it normally could. It's not painful, it just takes a while for you to open your mouth a little bit more and more as the weeks go on. I read somewhere to expect clicking in your skull, and I'm glad I saw that because otherwise I would think something was wrong. Sometimes when I would bend over, your skull makes a clicking noise. It doesn't sound right, but apparently it's just your skull adjusting so that it can heal right, and they say it's air pockets, that's the reason it's making those noises. If you're nauseous or have nausea problems like I did in the ICU, ask for a patch, because I got one later than I probably should have, and it would have helped a lot. If I would have had it earlier, I wouldn't have been puking so much. Eat as soon as you can. Getting food in your body will give you energy, and there's nothing that's going to help your recovery go faster or make you feel normal again. When you get out of surgery, you're not going to want to talk, and you're not going to really have the energy to, but when I did, everybody was asking me questions, and my family was trying to talk to me, and it was really frustrating because they didn't understand that I really couldn't talk and I didn't want to. So make sure your caretakers know that before you go into surgery, to keep talking and questions to a minimum. It'll make it easier for everybody. Don't let your pain get over a 5. I never really had terrible pain in my head with headaches or anything, but they say if you let your pain get a 10, it's way harder to come back from 10 to a 0 than from a 5 to a 0. So try to manage your pain. You're probably going to have some unexpected issues. I, for example, had issues peeing after my surgery. When I was in the ICU the first night or two, I wasn't able to pee, and I tried getting up and using a bedpan and nothing worked, so they had to put a catheter in me when I was awake, and my bladder was way over the point of being full. So weeks after surgery, I noticed my sleep schedule had been way off. I get in bed and I fall asleep right when my head hits the pillow. And I started, when I tried to go to bed, I wasn't able to fall asleep till midnight or 1, and that whole few hours when I was just laying in bed, my head's going 100 miles an hour, and I was just so anxious. Above all, try to stay positive throughout the whole experience. Your attitude will direct everything, so if you just stay happy, and especially going into surgery with a good attitude, you're gonna probably recover a lot faster. If there's anything I can tell you from my whole experience, is that if you have any family history of aneurysms, especially aneurysms rupturing, talk to your doctor to see if it'd be a good option for you to get scanned. Because a lot of times they're hereditary, and if you can save yourself from finding an aneurysm before it ruptures, you have a chance of saving your life. Good luck to anybody who's having this surgery. I hope this video can help somebody out to be more prepared and more confident going into surgery.